For the month of May, we're talking about testosterone. But this week, we're going to talk about testosterone differently because we're going to talk about the impact of excessive amount of testosterone in a woman. So this week, we're going to talk about the condition called polycystic ovarian syndrome. Polycystic ovarian syndrome, actually, it's a common endocrine disorder that affects many reproductive women aging from 18 to 40 years old. It's a condition so common that it's believed that affects between 2 to 20% of women in reproductive age. How is that influencing the androgen and the impact on sexual health? In fact, nobody knows what's the cause of polycystic ovarian syndrome because there's some genetic elements to it and also environmental evidence of it. So the genetic elements of it is obviously there's any family history, but the environmental impact, like for example putting on weight, diabetes, you're more prone to polycystic ovarian syndrome. In polycystic ovarian syndrome, women have characteristics of several things. Number one is actually the menses get a bit deranged. So therefore, women may have issues of oligomenses. That means that they don't actually produce so much menses and leading to infertility. Other issues that affect them is this excessive amount of androgen. Hyperandrogenemia actually may result in a lot of issues such as growing hair in the wrong places, called hirsutism, or it may be resulting in androgenic hair loss. Remember, last week we were talking about men having too much androgen and losing the hair? It's the same with women as well. And of course, we remember the days when we were having teenage years where the androgen, the hormone is all ranging away, resulting in acne and oily skin, and all these affect women suffering from polycystic ovarian syndrome. So, will that excessive amount of androgen causes heightened level of sexual desire and also the sexual performance in women? The answer is no. Scientific evidence shows that to the contrary of enhancing sexual libido in women, the actual polycystic ovarian syndrome induced elevation of androgen has no or minimal impact on enhancing sexual desire. On the contrary, many studies actually show that women who are suffering from polycystic ovarian syndrome has dissatisfaction when it comes to sexual activities. It's partly because of infertility, partly because of self-consciousness about hirsutism and also androgenic alopecia, and lastly, putting on weight actually get women less inclined to have sexual activities. So the treatment of polycystic ovarian syndrome itself actually is quite straightforward. Healthy lifestyle. So exercise, weight loss, and all these simple measures of healthy lifestyle can improve on the outlook of polycystic ovarian syndrome. We have more stories about androgen, and next week we're going to talk about men who suffer from male menopause. You also want to find out that if you have excessive amount of hormonal replacement therapy, i.e. I give you more testosterone, what sort of impact will you see on yourself and what sort of adversity you may be experiencing. So if you're keen to find out about hormonal replacement therapy in men, or to find out what are the signs and symptoms of male menopause, you know what to do. Stay tuned and carry on putting Dr. G on the spot.